Ovarian cancer is one of the gynecological neoplasms with the greatest clinical impact due to its high mortality rate and frequent diagnosis at advanced stages. Most tumors originate in the surface epithelium and are classified according to a dualistic model into type 1 and type 2, with clear differences in biological behavior, genetic stability, and molecular profile. While type 1 tumors usually develop from precursor lesions and have a more indolent course, type 2 tumors are characterized by high aggressiveness, rapid clinical progression, and marked chromosomal instability. From an etiopathogenic perspective, hormonal, reproductive, and environmental factors are involved, as well as genetic alterations related to DNA repair, especially in the homologous recombination pathway. Mutations in BRCA1 and BRCA2 play a central role in hereditary susceptibility and influence both clinical presentation and therapeutic response, particularly to platinum compounds and PARP inhibitors. Furthermore, certain gynecological conditions and exogenous exposures can modify the risk, reinforcing the need for a comprehensive assessment. Overall, knowledge of the histological subtypes, their immunophenotype, and their molecular characteristics is essential for establishing an accurate diagnosis, stratifying risk, and guiding individualized therapeutic decisions in epithelial ovarian carcinoma.